Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So today I want to come on and discuss melanoma and how that can be related to VA disability. So melanoma is a type of skin cancer that many veterans suffer from, many people suffer from, and they can develop it on active duty. It can develop many years later, and it can be related to exposures that someone had while on active duty, right? So the Mayo Clinic says that that melanoma is a kind of skin cancer that starts out in the melanocytes. Melanocytes are cells that make the pigment that gives skin its color. The pigment is called melanin. Melanoma typically starts on skin that's often exposed to the sun. This includes the skin of the arms, the back, face, and the legs. It can also form in the eyes. It can also happen rarely inside of the body, like inside of the nose or the throat. Mayo Clinic says that the exact cause is unknown, but most melanomas are caused by exposure to ultraviolet lights. Ultraviolet light, also called UV light, comes from sunlight or tanning lamps in beds. Limiting exposure to UV light can help reduce the risk of melanoma. Who is exposed to a lot of sunlight? Folks that are deployed for sure, right? So let's talk about some of the literature that I use, right? So first of all, under the PACT Act that recently was passed, melanoma is now one of the presumptive conditions for exposures, Gulf War exposures, okay? So we're going to get into that a little bit. So the recent passage of the Sergeant First Class Keith Robinson Honoring Our Promise to Address Comprehensive Toxins, PACT Act, the VA added 20 new burn pit and other toxic exposures, presumptive conditions based on the PACT Act. The act shows that if a service member deployed to certain locations to include the areas of Southwest Asia in the first Gulf War after 1990, exposures to environmental toxins is presumed. The PACT Act added 20 burn pit or other toxic presumptive exposure conditions, and melanoma is one of the presumptive conditions under this legislation. So it is well known in the medical community. So here's one of the articles that I use unrelated to PACT Act, right? Just for any veteran. Skin cancer in the military, a systemic review of melanoma and non-melanoma skin cancer incidents, prevention and screening among active duty and veteran personnel, published in the Journal of American Academy of Dermatology from June of 2018, conducted an extensive review looking at skin cancer risk of U.S. military personnel. They reviewed 9 studies that described an increase in skin cancer incidence of military personnel, 4 of which specifically looked at melanoma. Increased incidence in all types of skin cancer was related to service in tropical environments. Several of the studies implicated that an increase in sun exposure during service was a cause of higher rates of skin cancer among veterans compared to those that did not serve. They concluded that there was an abundance of evidence for increased risk of skin cancer development among U.S. active duty and veteran populations. Another article published in the United States Environmental Protection Agency in June of 2010 titled UV Radiation explains and discusses the sun's rays and how the sun's rays are strongest at the equator where the sun is most directly overhead, and UV rays must travel the least distance through the atmosphere. Another article, Malignant Melanoma, published in Stat Pearls, discussed melanoma being a tumor by the malignant transformation of melanocytes. Again, it just goes on and on about UV radiation and exposure, closer exposure to the sun. Ultraviolet radiation exposure risk and protection in military and outdoor athletes, published in 2020, stated that in addition to those who participate in outdoor recreational exercise or sport, military personnel represent an often overlooked group with unique exposures to UV radiation that likewise place these tactical athletes at higher risk for melanoma. So several studies have compared the incidence of melanoma in the general population versus specific military populations with varied conclusions. Depending upon the specific subpopulation within the military, increased rates of melanoma and non-melanoma skin cancers have been observed among United States veterans who operated in equatorial climates such as Southwest Asia and the Western Pacific. Rates of malignant melanoma in the active duty personnel compared to the U.S. general population are 62% greater in the military, with the highest incidence observed in the Air Force. Okay. So there's a lot of research that discusses the increased risk of all skin cancer types, melanoma included, in veterans. Let's see what the old va.gov says about the PACT Act and melanoma. Melanoma and PACT Act. So va.gov, if y'all don't know, is a wealth of information. They put a lot of information out there about a lot of resources for veterans. So let's see. Melanoma. We consider these melanomas presumptive, melanomas of the eye, melanomas of the skin, mucosal melanomas, which are melanomas that originate in the tissues that line internal areas of the body. Okay. So this in va.gov says this is not a comprehensive, complete list, right? So I hope this was helpful. Don't forget about skin cancer. That can be related. Now, if you served unrelated to Gulf War, if you served, you know, a year and you were in Alaska, you were in a climate that was not very sunny, right? That you got to take these things into consideration. Were you 20 years in the Navy and 15 of them were on a ship and you were on the deck getting sun all the time? So we have to look at lifetime exposure to sun as well. So I hope this was helpful. As always, thank you for watching. Please drop some comments if you have any questions. A lot of this literature applies to other types of skin cancers, and I'll probably do some videos in the future on what to expect in a CMP exam for skin cancer. And then maybe we'll talk specifically about basal cell and squamous cell carcinoma. Also, don't forget that those skin cancer scars are also things that can be service connected. We have a great video on scars and what to expect in a CMP exam for scars. So thanks for watching, and I'll talk to you guys later.